Let's bring in Dr. Nermen Bostros. Doctor, thank you for joining us.
Thank you for having me.
So first I want to ask you, what are you seeing in your ER, and are there enough beds and respirators for the current patients that you have who you suspect have COVID-19?
So actually in the ER is really hectic right now because we keep getting more patients and the volume is really increasing now. So yeah, we are running tight in terms of ventilators, isolation rooms, beds for the patient. We are doing our best trying to accommodate change the structures of the teams, creating new teams, creating a new COVID ICU unit, creating a new floor for isolation, but we're still very tight and we need more supplies. Yeah.
If you could just wave a magic wand, what would you say that your hospital still needs to fully serve your patients? And does your staff have the critical protective gear that you need? And are you bracing for shortages?
So I understand that it's a national shortage in terms of PPE, but I cannot emphasize enough on how important this PPE to doctors and nurses and also healthcare workers, because every healthcare member right now is very precious and irreplaceable. We need all the doctors right now. We cannot afford that any of the doctors fall sick or anything. So the hospital management here trying their best to provide us with the supplies, but we still need more because it's a continuous consumption of these PPEs, so we need continuous supply.
Some hospitals are urging patients to put off surgeries, in some cases really serious surgeries during this coronavirus crisis. Is that your advice as well? And if so, does that apply to every surgery? Could Americans start getting sicker if we delay other health care needs?
We understand, but and at this point, we have to be flexible. If there is an elective surgery or elective procedures that can be postponed for a few weeks, we have to do this. I know it might delay patient care on other side, but we have to do this. Right now, we have to deal with the acuity of the COVID crisis. So it's not a choice. We have to delay any elective procedure, and we have to be very flexible in this critical situation.
We've also heard of those who need certain medications like hydroxychloroquine, which helps treat lupus, not being able to find it. Many people are saying who really have it, who need it. How concerning is that?
I'm concerned that people may try to prescribe it for not the right patient, not necessarily, because it's recommended for those acutely ill patients or those are with severe lung injuries and in certain situations. It's not for everyone. It's not for protection. And if we're running short of this medication, we are preventing other patients like lupus patient or some other rheumatology patient from having this drug. And I think we have to be wise in the way we are using this drug and treating patients.
President Trump today said that he hopes to get the economy running again by Easter, which presumably means less social distancing. So does that worry you? And what would that mean for healthcare workers on the front lines?
I cannot comment on the political decision. As physicians, we will continue doing our job, taking care of the patient, doing everything possible to take care of our patients and make them getting better. And I will leave the political decision for the politicians.
All right, doctor, thank you so much for your time and for talking with us. Stay safe, and thank you for the work that you do. We greatly appreciate it.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.